Dr. Alana, and I am here to talk to you a little bit about trauma-informed healthcare, which is a massage therapy elective. To give you a bit about what the course entails, it's 7 weeks, 2 hours per week. The first and 7th week we meet virtually. Weeks 2, 3, 4, 5, and 6 we meet on campus. There are course assignments. There's reading assignments that are from the course text. Quizzes that are based on those reading assignments, discussion posts to get a little bit more in depth with what you're learning and kind of sharing some stuff with each other about maybe some things that you're struggling with in the course, as well as what you're getting out of the material. There is one written assignment. It's a final paper just to kind of solidify some of the information based on maybe some content that's outside of the course and how it relates to your profession as a body worker. And then there is a brief final examination. So what does it mean to be trauma informed? That's kind of what the real gist of the course is all about. So we go through a bit of history, talking a little bit about the meaning of psychological trauma, the role of boundaries, how psychological trauma shows up in the physical body, kind of talking about what does it mean for you as a healthcare practitioner on when some of these things show up. How do you know who to refer to and why? When would you refer someone out? Because you're not learning how to be a psychologist or a counselor. You're just learning how to be a better body worker and to be more present when people do experience some of those things that may be related to previous traumas that they've had. And then most importantly, how can you help yourself in this whole process? Because really, it isn't about what you do as a massage therapist, like the techniques that you perform. It's really about how you show up in the room, about your presence. That's what's really the most meaningful and the most helpful for people who have experienced trauma that are coming in for various forms of body work. And I just wanted to throw in here a little bit about what past students have said. So one student said, the surprise of this class was that I found answers that helped explain the workings of who I am. I learned the reasoning of staying true to myself, setting boundaries, not walls, and being comfortable with the word no. They go on to say ethics introduce the concept, but this course drives home by recognizing permeable boundaries, why they form, and the importance of resolving trauma within oneself. Another says you cannot leave this course without learning some truth about yourself, and I am grateful. One of my favorites is it's $5,000 worth of therapy for $370. And another student says, I got a lot out of this course. We went deeper than I expected in the few weeks we had, and I'm really glad that I took it. So again, Dr. Alana, if you have any questions, you can always send me an email. Hope to see you in the class. Okay, bye.